We will be doing regular squats. I understand that many of you will say it's impossible, that the pain is too sharp and so on. We will be carefully working on the very back of our thigh, that specific area which frequently bothers us the most and often hurts us the most. Remember, truly no one but you yourself can genuinely heal you. Hello friends. Today, as always, we meet on our channel Healthy Movement. Our channel is about exercises that help you get rid of back and joint pain. No surgeries, no medications, only with the help of exercises. My name is Maxim Mamchur and I am the co-founder of a network of kinesotherapy centers. And kinesotherapy is treatment through movement. Our center is called Healthy Movement. And today we are going to talk about the following. If you feel pain in your leg from the sciatic nerve, pain so strong it feels like a rod, I will tell you how to relieve this pain by at least 70% at home with just 4 exercises. So please do the exercises in the exact order and number of repetitions that I carefully demonstrate, and I assure you 100% that you will truly feel significantly better. The main thing is to endure, do them, and you will be healthy. Let's get started. Second, the sciatic nerve. Most often it becomes inflamed or pinched when we have herniated discs in the lumbar spine. Against this background, the innervation along the nerve worsens, and in the area of the gluteal muscle, we have what is called the piriformis muscle. This muscle can go into spasm. There are more serious processes involved, but simply put, the piriformis muscle spasms, and as a result, it further strains our sciatic nerve, causing pain throughout the entire leg. What concerns us the most at this moment? At this moment, what bothers us the most are the spasmed muscles of our muscle chain. Here is this kind of muscle chain. It contracts, and as a result, we experience such sharp pain that we can't even take a step forward or stretch this muscle chain. Accordingly, it's not so much the nerve itself that truly hurts, but rather we primarily feel pain when stretching our muscle. That's precisely why today I'll show you how to effectively fill this entire muscle chain with as much blood as humanly possible so that it becomes more pliable and we can stretch it and significantly reduce our pain syndrome. I'm confident that this set of exercises will significantly reduce this pain syndrome, and for many of you it might even eliminate it completely. So follow along with me, don't switch away or skip exercises because it's important to do each exercise in sequence. Let's get started. Alright friends, let's find a doorway. For me, it's between the exercise machines. For you, it's just a regular doorway. Grab onto it like this with your hands roughly at your hand level. And what are we going to do? We're going to do regular squats. Our goal is to get maximum blood flow pumped into the glute area. So what do? Hold on with your hands, squat back and push yourself up as much as possible using your glutes. Not using the front part of your leg, the quadriceps, but using your glutes. I need to tense them as much as possible at the top point. This way I'll get the maximum blood pump, pumping blood specifically into the glute area. Let's work. 1. Exhale. And 2, I want you to repeat after me, and 3. And if we are truly able to, let's try to go even deeper within ourselves to genuinely help ourselves. And 4, and we feel the buttocks straining them when lifting. 5 and 6 and 7, and so 8 and 9, and well, 10, enough. And so in the very next exercise we will really work on the back of our thigh, which quite often bothers us the most and indeed truly hurts the most. This will be a difficult exercise, but it's very important in our routine. So try to repeat it exactly as I show you. I lie down on the floor. I slide my leg under the bed. I have an imaginary bed here. This is my exercise machine. I put a towel under my pelvis. A rolled up cushion. I have a little ball like this. You'll need a bigger towel. Take it, roll it up, and place it under your pelvis so your pelvis is rounded. Why? Because we need to disengage the lower back so it doesn't work during this exercise. What am I doing? This is a small amplitude exercise. What does it do? I simply press my heel against my bed. I press down as much as possible, feel the back of my thigh, and then release. What does it look like in practice? Let me show you. 1, starting position. You can also put something under your knee so it doesn't press on the knee. 3. Press down as much as possible, then slowly return back to the original starting position. 4. And gently exhale. 5. And slowly exhale. 6. Really feel the deep stretch in the back of your thigh. And 7. We will definitely perform this exercise with both legs, but we should always begin with the leg that bothers us the most. And 8 and 9, press down as much as possible. And 10, do the exact same with the other leg, making sure to move with care and attention. So friends, do at least 3 full sets of 10 repetitions, no less than that. If you can comfortably do 15 to 20, then definitely do 15 to 20. At the end of this exercise, we should really feel the back of our upper thigh. It's filled with blood and has worked physically, so that we can now start stretching the muscle that's pumped full of blood. Then let's move on to the next exercise. So friends, what do we have? The glute is pumped with blood as much as possible, and the muscle has become more elastic. The back of the thigh, the biceps, are also pumped with blood, and the muscle has also become more elastic. Now, when it becomes more elastic, our task is to work on this stretching, to stretch this muscle as much as possible. This will not be an easy exercise. It will be a bit painful. I remind you, we do not go into acute pain. We work at the pain threshold, but each time we increase the range of motion. What do? Look, I take a towel, put it on the floor, and the leg that bothers me, where the sciatic nerve is inflamed, I place it on the towel. My other leg is bent and I use it for support. What do we do next? While holding these legs, I perform this kind of extension. Once I reach the pain threshold, I return to the starting position. At the same time, look, I press my pelvis as close to the wall as possible. I keep it as close as possible. I stretch as much as I can, then return to the starting position. You can even pull your toes towards yourself. Move with your heel, then back to the starting position. And I do this for 50 repetitions. Let's go. 1, 2, and 3, and 4, and 5, and 6, and 7. With each repetition, I progressively increase the range of motion. I can assist myself a little with my hand. I do not go into sharp pain, but I try to gradually increase the range of motion so that the muscle, which I remind you is already prepared, stretches more and more. What exactly comes from this muscle? It's responsible for the fact that we can't move our leg forward, that we can't lift it, and that it hurts. As soon as we effectively relieve this muscle spasm, we will immediately feel significant relief, 16 and 17. And with each subsequent repetition, gradually increase this comfortable range of motion, 18, 19, and 20. Even I can already feel how much easier it is for me to put my leg down. Although in principle, thank God, I don't have any pain at the moment, but at first I couldn't put it down because of my flexibility. And now I can already feel that it's much easier for me because I've stretched it. The same process will happen to you if you have sciatica, inflammation of the sciatic nerve. That's enough. Do the same with the other leg, 50 full repetitions. Take a full minute to rest, drink some refreshing water, and then repeat the entire sequence. 50 with the left, 50 with the right. Again, take a minute to rest and drink some water. 50 with the left, 50 with the right. This exercise in the amount I mentioned is mandatory. Don't skip it. And now we move on to the final exercise. So, the final exercise. What do? We take our towel. Lie on your back, bend your knees. Pull the leg that bothers you towards yourself. Hook it. Hook our towel around your foot. The towel should be long enough so that your elbows stay on the floor. What do? The right leg is bent, it stays in this position. The left, and what do? 1, stretch as far as I can. Straighten it, return to the starting position. Again, with an exhale, each time increasing the range of motion. I understand that many of you will write, this is impossible, this is very sharp pain, and so on. Believe me, friends, I know what I'm talking about. I see such patients every single day in our dedicated centers. If we consistently work on it today, tomorrow, and the day after tomorrow for an entire week, this particular muscle will definitely yield to us, and each and every time the range of motion will increase more and more. So we do it the same way. 3 sets of 50 repetitions. Here is the right side. And always remember, no one else but yourself will truly heal you. No one else will cure the inflammation of your sciatic nerve. At best, it's just a feeling of immense relief. And look, my overall range of motion is already so much better, even though at first I absolutely couldn't straighten my leg either. "50 repetitions, the same with your right leg, even if it doesn't bother you. 50 repetitions. After that, we drink some water, rest for a minute, and then do the second set. Again, drink some water, rest for a minute, and then do the third set. And on the third set, you'll already notice how much better and easier it is for you to do this exercise. Friends, I hope you managed to do all the exercises. If not, please send me a message so I understand. What to adjust in future videos? Let me know how you felt after completing the exercise routine. This is also important. For example, I am sure that you will feel much better after just the first session, because I know firsthand what sciatic nerve inflammation is, my friends. Please write and describe your experience. Share this with your friends. Maybe some of your friends really need this gymnastics routine. If you liked it, give a like for Ukrainian content. Stay healthy and see you next time.